My name is Beatriz Grinsztejn. I am an infectious disease physician scientist based at the Instituto Nacional de Infectologia Evandro Chagas at Fiocruz in Rio de Janeiro, Brazil, where I lead the SPI HIV Clinical Research Laboratory. For more than 3 decades now, I have dedicated my career to clinical care, research, and the training of future generations of health professionals and young investigators in infectious disease. I lead a multidisciplinary research group committed to generating scientific evidence that informs public health policies in prevention, treatment, and care, particularly for populations that continue to face stigma, discrimination, and barriers to accessing health services. Our work seeks not only to advance scientific knowledge, but also to promote more equitable and effective health responses for the communities most affected. I have had the privilege of contributing to studies that helped shape the HIV response in Brazil and internationally, including research on treatment as prevention, oral and long-acting HIV PrEP, and scientific strategies to expand access to effective prevention tools. This includes ongoing studies assessing the implementation of cabotegravir, lenacapavir, and doxypep within the Brazilian public health system. We have also worked to better understand and address the health needs of transgender women and other populations disproportionately affected by HIV and sexually transmitted infections. In addition, our team has contributed to public health responses to infectious disease emergencies such as COVID-19 and Mpox by generating evidence to support clinical care, prevention strategies, and public health decision-making. This work has never been an individual endeavor. It has been built together with colleagues, collaborators, community partners, health professionals, young investigators, and above all, with the participation, trust, and generosity of the people and communities who have engaged in our studies over the years. I am deeply honored to receive the Christophe Mérieux Prize. This recognition is especially meaningful because it underscores the close connection between research and public health needs and the profound impact that scientific evidence can have on people's lives. For me personally, this award carries a deep significance. As a Latin American woman scientist who has spent her career building science within a public institution in the Global South, I am especially honored by this recognition. It reflects the value of scientific excellence rooted in strong public institutions, close engagement with communities, and a commitment to addressing the health challenges that matter most to our society. Receiving this distinction is both a recognition of what has been achieved and a powerful inspiration for what still lies ahead. I hope this award helps strengthen our efforts to build research capacity in Brazil and across Latin America, support new generations of scientists, and ensure that scientific knowledge is translated into equitable public health policies and stronger health systems, including Brazil's unified health system. Most importantly, I do hope it contributes to our collective work to confront stigma, discrimination, and the social inequities that continue to fuel HIV and STI epidemics. I'm very grateful to the Foundation Christophe and Rodolphe Mérieux and to the Institut de France for this incredible honor. This recognition reinforces our commitment to rigorous, collaborative, community-centered science and to the belief that scientific excellence and social justice must move forward together. Thank you very much.